I'm here to talk about Renuva. Renuva is one of my favorite biostimulators. It helps grow your own fat. So it's an alternative to a fat transfer. So what is it? It comes from human liposuction donor patients. So the company only accepts 2% of the best looking fat donations. Not all fat is created equal. Certain fat is healthier than others and works better at transferring for aesthetic purposes. But none of that person's DNA or intracellular content is going into you. So they break down the cell wall, they clear out the intracellular content, then they extract the extracellular matrix, they put that through gamma irradiation, so it clears out the possibility of any diseases or anything like that. It essentially sterilizes it, and then it's packaged in a sterile way, and that is what's transported to me so I can inject into you so that we can help you grow your own fat. So, who is a good candidate for this? This is great for people who don't have a lot of fat and can't do their own fat transfer. It's great for people who have lost a lot of weight. Maybe you've gone through a weight loss journey on a GLP-1 or something like that. You've lost a lot of volume in your face. You're wanting to revolumize that in a natural, long lasting way. Renuva is a great option. It's good for people who are wanting to steer clear of synthetic injectables like HA fillers, hyaluronic acid fillers. Renuva comes from a human source. It is all natural. As I mentioned, you cannot reject it because there's no DNA going in you. It's a very safe product. You're making your own fat to it. It lasts a long time. So the average life cycle or lifespan of an adipocyte is 8 to 10 years. So as long as you are not going through a major weight change or weight shift after having it injected, I mean, whatever fat you grow in response to it can last for years afterwards. I mean, studies are still ongoing. It is more expensive than traditional injectables out there. It's more expensive than Sculptra. It's more expensive than hyaluronic acid fillers. These are other volumizing products, aesthetic products out there. But it does last the longest. So there's the upside. With any biostimulator, it does take a couple of treatments. So I usually say you're going to need 2 to 3 treatments of Renuva. The treatments are typically spaced 3 to 6 months apart. That's a little bit slower growing. You're going to need to give it time to help grow your fat. Unlike Sculptra, where Sculptra after you have it injected, the volume goes away in 2, 3 days. You don't see it. And then it takes a little bit of time to grow back. You do retain some of that volume after Renuva is injected. So that's great. The volume doesn't go away. It goes down a little bit, but it doesn't go away completely. So you still retain some of the volume from that extracellular fat matrix being injected. And slowly that fat matrix, think of it like little honeycombs, our fat cells start to grow up in between them. It creates a nice, hearty, healthy home for them. And so slowly that matrix will break down and our fat cells grow in place of it. So it's kind of like a shifting volume change there. You can hit a little bit of what I call a Renuva trough. That's around week 4 to 6 after it's injected, where the volume will go down a little bit, not all the way, about 50% of maybe what you see after it's injected, and then it slowly starts to go back up. So again, good candidates are people who are wanting to restore soft tissue volume. This is great for the mid face. We lose that deep medial cheek fat pad as we get older. Very thin, gaunt people where fat transfers aren't an option because there is no fat for the surgeon to take to transfer. So great for people who aren't candidates for fat transfer, who are wanting a natural restoration of volume, who are wanting to stay away from synthetic injectable products, who want something more longer lasting. Clients who it wouldn't be good for. Clients who are still going through a weight loss journey. They plan to lose more than 10 pounds. And because it's going to act like how fat does. You're growing fat in response to it. It's not good for people who are training to do like bodybuilding competitions, who are still trying to lose weight, who are maybe, I had a client who she was really trying to get in shape for her 50th birthday. We did Renuva. I did not know this was going on afterwards, but her testosterone, she increased her testosterone levels. She was wanting to get cut for her 50th birthday. So she increased her testosterone and she increased her GLP-1 dose a little bit. And she didn't have the best results with Renuva because it's going to inhibit her. Those things are going to inhibit her from growing fat. So you want to be at a state where you can grow fat in the area, not where you're at a high metabolic burn, because then you're not going to grow fat very well. So you want to wait until your goal weight, and you're not trying to burn fat significantly. You're just trying to maintain your weight when you get Renuva injected. So what does a Renuva appointment look like? So after a thorough consultation, of course, we have you come into the office, you numb for 30 minutes. I take the Renuva, which comes in as a thick, yellow golden paste. It looks like fat in a syringe. Comes in a 1.5 and a 3 cc syringe. And I mix it with different amounts of saline depending on the area in which I'm using it in the face. Um, this can be used. It's great to restore temporal volume. It's good for mid-face volume, nasolabial fold. I will sometimes use more of a diluted version of the Renuva to get into the tear troughs a little bit. I even sometimes mix Renuva with PDGF in patients where I think that they might need a little extra boost to help with that fat growth, and it also helps with collagen production. So I actually have enjoyed mixing it with PDGF. That's off label, but I've had great results. I've done it in myself. Sometimes in the marionette lines, if patients get really gaunt throughout this area, anywhere where you're needing to rebuild volume, and if there's fat that's naturally there, a little fat layer there. It's not meant to be placed in areas where there's no fat. It's not going to grow. There needs to be a natural subcutaneous fat pad there, or a fat pad in the area in which we inject it for it to work. So it's injected with a cannula. So bruising is very rare with this treatment. If bruising does occur, and I still encourage patients to do this beforehand, take arnica for 3 to 5 days before, 3 to 5 days after. We sell arnica fort here in the office. It's a combination of arnica and bromelain. Bromelain comes from pineapple, really great to help prevent bruising. So take that before and after, even though bruising is very rare when I'm using a cannula and using the techniques that I do. After the treatment, I do like patients to massage the areas that I inject the Renuva in. You want to keep that Renuva dispersed evenly throughout that area, even though nodules are very rare with Renuva. It's a very safe overall injectable to work with. And icing if you need to help with swelling. But overall, because it comes from a human source, there's not much swelling that I see from it, and no allergic reactions. It's really an all natural product. So that's what's great about it. So, all in all, I love Renuva. It's a wonderful biostimulator. I use it in conjunction with other biostimulators, as I mentioned, PDGF to help exponentiate the results, which also helps with collagen production as well. I love using it with Sculptra. So it works well with Sculptra. I've sometimes injected Sculptra in the periphery, let's say like jawline, temple area, and use Renuva to help rebuild the mid face, because this is where we want to see a lot of soft tissue growth in this area. And you can only get Sculptra so close to the eyes. As I mentioned, I fan Sculptra up into the tear trough area and get really great results. So I use it with different biostimulators, so it can be paired in different treatments, and it's just an overall great product to work with. If you have any questions, you want to learn more, you can reach out below. If you want to schedule an appointment or a consultation, visit bijoumedspa.com.